My name is Shelley Clark. I'm the Stroke Program Administrator and Registered Nurse with Crouse Hospital. One of my roles is to coordinate the care of the stroke patient and provide the best possible procedures, policies, so when the patient comes in the door, all the way through their rehab and going back home again, we make sure that everything possible is done for the stroke patient. At a very basic level, a stroke is an interruption of blood flow to the brain. That interruption of blood flow can be the result of a clot that causes a blockage, so the blood doesn't get to the brain for that reason, or it can be that that blood vessel ruptures and there's bleeding into the brain. In either case, the brain cells are not receiving the oxygenated blood it needs, and those brain cells die. And once brain cells die, we cannot get them back. FAST is an acronym that we use. It's F-A-S-T. And what we try to do is take the symptoms that are most recognizable by other people. In other words, if I'm looking at you, I can tell that you may be having a stroke. And it puts it into a nice, easy way to remember it. So what is that? FAST. F stands for face. So we look at the person and we look to see if they in fact do have that facial droop. We ask them to smile, and maybe the smile looks a little uneven. A is for arm. We ask the patients to raise their arms. Maybe they can't lift one side, or maybe they can lift it but they can't hold it up. S is for speech. And again, we talk about the either inability to say the words are slurred, you can't find the word, or you can't understand the word as it's being spoken to you. And the last one is T for time. One of the things we want to stress is at the first onset of a stroke to call 911. Most common response is that people will drive themselves in, call their primary care physician, go lay down, and what we really want is people to call 911 so that they can rapidly come in and be assessed to determine if there is acute care treatment that we can give you right away. Time is very important because one of the things we have, if you have the type of a stroke that's caused by a clot, is that we have the type of medication that we call it a clot buster. If we're able to give that medication in the first 3, sometimes we have up to 4.5 hours, what it does is it opens up the circulation, allows oxygen to go to the brain, and instead of those brain cells dying, we're able to let those brain cells live, and therefore we can reduce the amount of disability that's associated with the stroke. It really helps to be on an ambulance to come into a designated stroke center. Why? Because first of all, an ambulance crew can recognize the symptoms, begin to stabilize you. They call ahead to the stroke centers. We've developed a partnership with them where we provide education, feedback, so that they in turn can learn how to manage a stroke patient better. Stroke affects everybody. We see it all walks of life. We actually are starting to see it in a younger population, and we attribute some of it to just the general unhealthy lifestyle of Americans. We're more sedentary, our diets are not as good. I'm passionate about stroke because for me it's always been what I call the underdog diagnosis. Nobody wants it. Obviously, I think the fear of disability that it carries, that stroke carries, makes everybody so afraid of it. And so what do we do when we're afraid of something? We want to sweep it under the rug and we want to pretend it doesn't exist. What I want to do is make people aware that it's out there. There are things we can do to decrease the disability with it. There are things we can do to help people who do have some disability, and I want to really bring it out in the open so that those people who have this diagnosis have a sense of hope.